Let's talk about the doctor's secret instrument. Today, we're diving deep into the hidden side of medicine, exploring the unseen forces in healing that can be way more powerful than any drug or procedure.
So let me just ask you, what is a doctor's most powerful instrument? Now, if a scalpel or some high-tech scanner just popped into your head, well, you might be in for a surprise. According to our source material, the answer is something way more fundamental, something we're going to call an intangible.
So, what are these intangibles? Well, they're the healing factors that don't really fit into neat scientific boxes. They're the emotional undercurrents, the subtle attitudes in the relationship between a doctor and a patient that can honestly be the deciding factor in a successful recovery. Okay, our first intangible might sound a little shocking as a clinical tool. It's love. And hold on, this isn't about some warm, fuzzy feeling. We're actually talking about love as a scientific concept, first seriously studied, not by a poet, but by the neurologist Sigmund Freud. The kind of love we're talking about here isn't romance. It's a concept called agape, which is this profound, selfless concern. Think of it as the deep devotion a physician has for their patient's well-being. And it's this very devotion that forges an essential healing bond. Freud actually figured out how this bond works through a process he called transference. This is when a patient, totally without realizing it, projects feelings and identities from their past, like seeing their doctor as a parent or a trusted figure. It's a really powerful, unconscious connection. And it's a two-way street. The doctor experiences something similar, and that's called countertransference. This is the doctor's own unconscious feelings from their past being projected onto the patient. Now, when a doctor is aware of it, it can be a huge help for understanding, but if it's unrecognized, it can actually be harmful. So let's just nail this down. Transference is what the patient feels toward the doctor based on their past. Countertransference is what the doctor feels toward the patient based on theirs. It's this kind of emotional dance that forms this deep, therapeutic, and often completely unspoken bond. Nothing illustrates this better than a letter from a patient. She was trying to explain why a simple comment from her doctor was so incredibly healing. And then it hit her. His words were powered by a genuine, deep love for all of his patients. But the discovery didn't stop with him. The patient realized this healing love wasn't just something she was receiving. It was something she was starting to feel growing inside herself. She called it a brand new happy experience, something that was totally free from any strain or weight. And then that feeling just expanded. It went beyond just her doctor. The entire hospital, the entire environment became a place filled with what she called countless little doorways to love. The place itself became part of the therapy. This phenomenon actually has a name, transference to a center. It's kind of like how people used to make pilgrimages to healing shrines. Patients today will invest that same kind of deep trust and hope in an entire institution. The very name of the clinic or the hospital becomes this powerful symbol that actually amplifies the healing process for everyone there. Okay, let's move on to our second big intangible, faith. And just to be clear, this isn't about religion. It's about a fundamental belief that has basically divided medicine for thousands of years, a debate over the very nature of healing itself. Seriously, this debate has been raging for over 2,000 years. On one side, you have these huge figures like Hippocrates, Paracelsus, and Sydenham, who all championed the power of nature. And on the other side, you had a totally different school of thought that argued for a much more direct interventionist approach. And here's the core of that debate, right here. On one side, you have the school of Cos, led by Hippocrates. They believed a doctor's role was to be a servant of nature, to trust in the body's own amazing power to heal, the vis medicatrix naturae. But on the other side, the school of Conitus saw nature as flawed. They believed the doctor must be an active intervener, to step in and correct nature's mistakes. This quote from Hippocrates just captures his whole philosophy perfectly. Nature is the healer of disease. That's it. It's a profound declaration of faith in those self-regulating, self-repairing forces that are always at work inside every living thing. So, where does all of this leave the modern doctor? How do you reconcile these two massive, powerful intangibles, love and faith? Well, this brings us to our final section, what doctors today truly believe. You see, the effective modern psychiatrists, they blend both traditions. They operate on the faith that illness is reversible because they see nature's own healing power as their greatest ally. So their job isn't just to intervene, but to awaken that cooperative spirit,
to find that hidden potential that's inside every patient. So, in the end, the most powerful healing happens right at the intersection of these two intangibles. It's the fusion of faith in the patient's own natural healing power, that this medicatrix natura, with the profound therapeutic power of love in the relationship.
And that leaves us with one last, really important question to think about. If love and faith are the doctor's most powerful, most secret instruments, what does that say about the patient's own power? What is our role in harnessing these incredible forces for our own recovery?